Since the pandemic started, researchers have discovered COVID-19 disproportionately affects different age groups and minorities.
Evening Edition's Claire Kopsky sat down with the dean of the University of Kentucky's College of Public Health and learned a lot of these disparities go back to heart health.
It's been a race to study a new virus and figure out its behavior.
There are some recent studies published in the Journal of the American Medical Association that show that there are long-term cardiovascular effects in up to 3 of 4 COVID patients who recover. And so it's really important, if you've had COVID, to be even more attentive to your heart health than usual.
That warning applies to everyone. But as Dr. Arnett found in some of her own COVID cardiovascular research, certain people need to be on higher alert.
We know that these underrepresented groups have higher burdens of comorbidities or pre-existing conditions that lead to a worse outcome with COVID-19. Those include obesity, hypertension, and diabetes in particular, and any kind of underlying cardiovascular disease already, which many African Americans and Latinx communities have more of than other populations, leads to this heightened mortality risk.
For those in high-risk groups, Dr. Arnett has a few strong recommendations.
It's critically important to wear your mask when you're around other people. And I would suggest even socially distancing 6 feet from other people. You know, what we find often is that people take off their masks to eat or drink. I mean, you have to, right? But if you're doing that in a social setting, we also know that the virus is aerosolized. That means, you know, it spreads not only through droplets, but it also spreads through the air around you.
It's a warning she hopes everyone will heed. In Lexington, Claire Kopsky, LEX 18 News.